Recording.
All right.
We're good. David?
All right. So welcome again. We're going to hear today about fungi because I'm a fun guy, as you all probably know. And I first want to start by asking, have you ever had an infection, athlete's foot, ringworm, or candidiasis? And the answer should be about half of you will have a fungal infection during your lifetime, whether athlete's foot, candidiasis, or in smaller instances, some of the more rare infections, but still relatively common infections. That said, the lecture is divided. The first hour is going to be devoted to these topics here: morphology, cell biology, talk about the fact that fungi have different forms, a bunch of diagnostic techniques, and then we'll talk about antifungal targets. Before we do, and then after that, we will talk about basically lots of different fungal diseases, and I'll try and boil those down to as few as possible that you have to actually memorize, but it's still a number of them. So here's a little overview when you're reading about it. And I think the most important thing that we're going to be talking about are the multiple forms that each species of fungus takes up, whether it's a mold, a yeast, or a mushroom, and a little bit about the ecology and geography of these guys as to where they live and what kind of infections they produce, because most of them, as you'll learn, are actually found just outdoors in the soil, because fungi are nature's recyclers, that they essentially cause everything that dies to rot, and that decomposition is also what makes them effective pathogens, their ability to decompose tissues. Basically, they're transmitted by getting the wrong stuff at the wrong time in the wrong place on your bodies, and being immunocompromised or compromised in some way, or unclean, that you end up with a fungal infection. Okay, and so with that in mind, here are this long list of objectives that I'm not going to read, but let's bring out the fungi, our category. And what we're talking about when we're talking about fungi are yeast, which are single-celled fungi. They grow as single cells, shown here diagrammatically here in an Namarsky optics picture. They're molds. Here you can see a mold under the microscope, but what you've all seen growing on a petri dish, or more likely growing on that piece of bread that you left out for 3 weeks that you think is disgusting. They're not terribly disgusting. Don't worry about it. You just throw it away. Okay. And finally, mushrooms. Mushrooms are very organized forms of these filamentous structure called hyphae. And my favorite mushroom of all is this guy. Okay, this is called a puffball. This happens to be the daddy of all pea balls, of all puffballs. It's got about 10 to the 14th cells within it, fungal spores within it, each capable of giving rise to another puffball, which I did a calculation as to why this is the daddy of all puffballs, that if each one of those spores were to give rise to another puffball, it would fill the entire Mediterranean. So they have incredible reproductive powers, fungi. They basically can grow limitlessly. And as this once was the daddy of all pea ball, it became at this point the ditty of all pea balls at one point. And then for a while, just the ditty of all balls, maybe the brother love of all balls, but basically we call it a puffball, okay? And basically fungi, Captain Marvel had a big problem with yeast at one point in the Captain Marvel series. Okay, so when we're talking about yeast, what are we talking about precisely? We're talking about a single cell stage of fungi, and many fungi don't have known stages that are different from this, whereas other fungi are dimorphic or multimorphic, pleomorphic, and they have more stages. But when we're talking about yeast, we're talking about a single cell that usually grows by a process called budding, where it sends out an asymmetric cell that grows and then divides. You have mitosis, it divides into two separate cells, and each one is capable of growing again to form another cell, and those grow and grow just the way bacteria do, exponentially, as I described in the first lecture, to produce colonies that aren't all that different from what we see in bacteria. Okay, in the case of yeast cells, they absorb, the colonies absorb water, so they give you this glistening pasty-like substance. And we'll talk more about this pasty-like, cheesy-like substance when we're talking about real infections in the mouth or in other mucosal areas. Okay. In contrast, when a fungus is a mold it goes into the mold stage, it sends out a filament. And these filaments are called hyphae. Okay, and they grow filamentously at the tip. Okay, and when they run out of food, generally, they form asexual spores called conidia. Okay, sorry, sometimes they branch, but then they'll form an asexual spore called a conidia, which is Greek for dust. Okay, and these guys are capable of disseminating out in the wind. So this is kind of the way a fungus grows. Instead of moving, it just grows over long lengths. And there are documented cases where a single mycelial mat, shown here, and this mycelial mat here started out as a single spore in the center of the paper, and you can see that it basically expanded to a dimension of about 20 centimeters. So it was capable of, in the time it took to fill this plate with mold, to grow out 20 centimeters, which is how it spreads out and how it doesn't need movement. But on the other hand, it produces these spores that are capable of being blown about. So when a fungus runs out of nutrients, it doesn't want to be in the same place. These spores are produced, they blow within the wind, they land in another place where it can grow again, they'll germinate and produce another mold, or in some cases yeast, as you'll soon learn. Now, probably the most important thing I'll ask you, and I certainly ask a question like this on virtually every exam, is that fungi are eukaryotes, which means that they have a nucleus, and that nucleus is filled with linear chromosomes, mostly. That nucleus is capable of dividing via mitosis. It makes a cytoskeleton and a spindle during mitosis. And it also contains different ribosomes. So they have nuclei, they have mitochondria, vacuoles, vesicles, a cytoskeleton, linear chromosomes, a cell cycle, as I mentioned. And they have multiple RNA polymerases, and most important, they have ribosomes that are like ours. Okay, these ribosomes that are like ours are not affected by the antibiotics we learned about that affect ribosomes. They're resistant to tetracyclines, erythromycin, etc. Okay, which means they are more like us. They're eukaryotic ribosomes and harder to kill than bacteria. On the other hand, they do have a couple of targets for that. Okay, for example, they have a plant-like rigid cell wall. Okay, and that rigid cell wall is comprised of two layers, what we call the glucan layer, which sometimes has chitin in it, but it's usually made up of a glucose polymer. You can see it here. And an outer layer that is a mannose polymer. This is just another 6-carbon sugar that's polymerized in these complex polymers that are bound to proteins that are ultimately bound to the plasma membrane and form this bi-layered cell wall. Glucan on the inside, mannan on the outside. That's all you really have to know, okay? And the mannose is usually associated with some proteins. So all you have to know, the proteins are important because they help stain the thing when we are looking at clinical specimens. The other very important and most important difference between fungi and mammalian cells, and represents an important target for chemotherapy, is the fact that fungi largely don't contain cholesterol as the predominant sterol in their cell membranes. They contain ergosterol, which differs from cholesterol in this unsaturated bond over here, as we can see here. This is going to present a very convenient target for chemotherapy. The other thing, the next thing I want to tell you about fungi is that fungi produce a mycelium, which I mentioned before. And when we look at that mycelium under the microscope, we see hyphae, as I told you, which are these tube-like structures. And we see conidia, which are the little spores that are capable of usually being airborne. These are two kinds of conidia shown here. And we identify fungi from usually the morphology of these conidia. So for example, I can tell I see conidia that look like this in these chains coming off a specialized structure, and I know I'm looking at Aspergillus. When I look at this, I have to look at more because almost every fungus has hyphae that look pretty similar. So the hyphae don't enable us to tell what kind of fungus it is. We have to look more at the spore morphology. So fungal identification, and when we're looking at clinical samples, is largely based on the hyphal and asexual spore morphology. On the other hand, fungal classification, how we classify these for phylogenetic purposes, is based on their sexual spores. So these are completely different parts of their life cycles where fungi have sex, and these sexual spores tell us where it belongs in the phylogenetic tree. Okay, so when we're looking at hyphae, we have two kinds of hyphae. We have what are called septate hyphae, shown here, and they have little septa in it that you can see separating the different parts of the hyphae. And we have non-septate hyphae, which don't have septums separating all the different parts of the hyphae. Now, an important aspect of this is that hyphae, whether it's the chambers or whether it's this big long tube, are polynucleate, which means they are a syncytium. Okay, it's syncytium, more than one nucleus per chamber, many nuclei per tube. Okay, so we have this syncytium. Now, in addition to hyphae, some fungi don't quite form hyphae, they form long chains of yeast cells. Okay, so you see long chains, and these yeast cells have only a single nucleus in it unless it's actively dividing. Okay, and and when we have these chains of yeast cells, they're referred to as pseudohyphae. So if you have a mycelia of a real fungus making, whether it's septate or non-septate, it's called a mycelium. But when you have pseudohyphae, we refer to it as a pseudomycelium. Okay, so again, mycelium versus pseudomycelium. Okay, now we have a whole lot of non-sexual spores capable of germinating to produce another hyphae, shown on the next slide. All different kinds of fungi make all these different kinds of spore morphologies. Okay, and you just familiarize yourself. You don't have to memorize this fungus makes arthrospores or this fungus makes chlamydospores, with one exception that I'll tell you during the lecture, or two exceptions. But essentially, these spores are called aleurospores because they resemble the aleuron of a wheat, to somebody who named them. These are called arthrospores because they look like the joints of an insect, or like an arthropod. Okay, and as a result, they're called arthrospore, jointed spores, and they grow within the hyphae shown here. Okay, then we have chlamydospores. These are round spores, round thick-walled spores shown here, and we'll hear about tuberculate chlamydospores when we talk about histoplasma. That's one of the things I want you to remember. Okay, and then sometimes a hyphae gives rise to simply a yeast cell, and when it does that, it's called a blastospore. So here we have hyphae giving rise to yeast cells. Okay, and then we'll also talk about spherules, that a term you'll have to remember. Okay, so these are all the different kinds of asexual spores that are produced usually when a fungus runs out of food and it wants to move around in the wind to some other place. Okay, and don't forget I add these stars on what I think are important slides. Okay, so now let's talk about sex in fungi. Okay, and each fungi, many fungi have sex. Okay, many fungi have known sexual cycles. Probably all of them do, but some of them may have lost it recently and don't exhibit it. We call the different sexes sometimes A or alpha, plus or minus, sometimes male and female. Doesn't matter. It depends on the mycologist who named it. And sex in fungi is involved, as I mentioned, in their classification. And there are 4 major phyla of fungi: Ascomycetes, or Ascomyces, or Basidiomycetes, or Basidiomyces, Zygomycetes, or Zygomyces, or Deuteromyces, or Deuteromycetes. Okay, now, unfortunately, Deuteromyces are ones we just haven't classified yet. So we just put them in this big classification, and we sometimes refer to these as fungi imperfecti. Okay, that said, I'll tell you the differences between these as soon as I tell you how fungi have sex. Okay, so if you're young and you don't want to hear this, cover your ears, but let's hear about sex in fungi. Hope you have your sound on. When we're talking about sex in fungi, we're talking about 2 different cell types. We call them A and alpha, plus or minus, A or B, as I mentioned. And generally what happens is fungi grow as these long tubes, as shown here. And when 2 fungi of the same species, but of different mating types or sexes, encounter one another, okay, when they're growing, they're secreting pheromones. Okay, these are chemical signals that actually stimulate that of the other sex. And what they say is, honey, you're my species and not my sex, so let's do it. And the other one answers back, you make my RAS protein go crazy. And why do I tell you this? Because what goes on is that they stimulate a cell cycle dependent control where they stop the next cycle, the next sexual cycle. They essentially say, hold on, put on the brakes and differentiate, because we're now going to mate. And that involves a RAS dependent protein kinase chain of events where a RAS protein is signaled by this pheromone. The RAS protein releases a controlling factor that then goes and stimulates a bunch of protein kinases, that kinase a bunch of proteins, that kinase other protein kinases that ultimately go to the nucleus and send off a signal to differentiate. And that differentiation causes 2 cells usually to grow towards each other and ultimately fuse, shown here. And then the nuclei from those 2 cells fuse, because those cells were haploid, but now we have this zygote, and that zygote can actually form more fungi in certain fungi and grow vegetatively. But ultimately, cells from that vegetative stage are going to undergo meiosis. And following the process of meiosis, which you know are 2 cell divisions, 1 and then 2, to produce 4 haploid spores. These are sexual spores, and 2 of them are going to be one mating type and the other going to be the other mating type. And they're going to be released from this structure, okay, and resume that process all over again. The sexual spores are going to germinate and begin that cycle again. So this process of sexual differentiation and meiosis to produce more fungi has enabled us to classify the different phyla as either Ascomycetes, Basidiomycetes, or Zygomycetes, as I told you before. And Ascomycetes means that the sexual spores are going to be in a sac or an ascus, shown here. And many common fungi like Neurospora and Aspergillus, as well as penicillin that produces antibiotics, are Ascomycetes, as well as Saccharomyces that produces beer and wine. So you get spores in a sac. In contrast, we have Basidiomycetes. And here, the sexual spores and Basidiomycetes are mostly mushrooms. And the sexual spores can be found on a base on the underside of that mushroom cap, shown here. And we'll hear about Basidiomycetes when we're talking about a fungus called Cryptococcus, but we'll also hear about a couple of poison mushrooms like Amanita. But I don't want to forget some delicious mushrooms like porcini or agaricus, which make food so delicious if you happen to like them. Okay, finally, we have Zygomycetes. Okay, these are the non-septate, very large diameter hyphae, about almost 100 nanomicrons in diameter. You can almost see these tubes with the naked eye. Okay, I used to be able to when my eyes were good. Now I can't quite see them. And these have a distinct sexual cycle involving this thick water spore called the zygospore. And we'll hear about this again in pathology when we talk about a species called mucor. Okay, and finally, we have this unclassified brand of fungi called Deuteromyces, or fungi imperfecti. And we just haven't discovered a sexual cycle yet. Maybe there exists, maybe it doesn't exist, but we just don't know of any. We haven't followed it around. It would be like a Martian landing in an old-time Shaker colony, where, if you know anything about the famous Shakers who made all that beautiful furniture, they didn't reproduce. Okay, so we just haven't found the origin of Deuteromyces and their sexual cycle yet. Okay, very important lesson up here. Fungi are saprobes. As I mentioned, they're nature's recyclers. They usually degrade and live on dead organic matter. And that's because what they do is they produce a whole lot of hydrolases that can degrade organic polymers. And as a result, they degrade these organic polymers and take up the unit subunits. They can of those polymers and can live on those glucose, for example, or maltose, or all those degraded sugars from all those polysaccharides that are out in the woods. But they can also contain lipases and proteases that enable them to make small molecules that they can take up and essentially reproduce and make more fungal macromolecules on them. Many fungi actually can live on very simple media like many bacteria, consisting of glucose, ammonia, sulfate, phosphate, and trace elements. So they really don't require complex organic environments, many of them, not all. I'll tell you about some that do require more complex behavior, but more complex nutrients. But the most important thing in this is that fungi are routinely grown on a substrate called Sabarodes agar. This is simply a mixture of a protein hydrolysate known as peptone, okay, as well as glucose and agar mixed together, and the fungi grow. Sabouraud's agar, it's a reference agar for speciating fungi. So when we culture them, look at their growth on Sabouraud's agar, we can tell what fungus it is. All right, that said, as I told you, fungi are eukaryotic organisms. A little bit about their cell biology. They have a nucleus with chromosomes and nucleolus. They have a nuclear membrane. They have a cytoskeleton, usually comprised of microtubules as well as actin filaments, okay, shown here. And they have an endoplasmic reticulum. And in order for them to secrete proteins, they essentially have signal proteins that enable the ribosomes to land on the ER and secrete proteins into the lumen of the ER. Those vesicles then go into the Golgi, where they're sorted out into a rainbow of different kinds of vesicles that then get transported to the growing tip of either the yeast cell or the hyphae, where if we're making cell walls, some of those vesicles will secrete cell wall components, whereas other vesicles will secrete all those hydrolases, proteases, nucleases, lipases, and most important, carbohydrolases that will turn cellulose or other carbohydrates into simple sugars, which can be transported in and used for fungal growth. And of course, they can process this and make lots of ATP using their mitochondria. Fungi can also grow very often just on glycolysis and not use their mitochondria all the time. So they're really pretty good. They can grow almost anaerobically as well. They're not obligate anaerobes, but they are many are facultative anaerobes. Okay, the other thing that's really important, as I told you, is fungi have different parts of their life cycle and completely different forms. So we're going to hear about a bunch of fungi that exhibit what we refer to as classical temperature dimorphism, which means that if a fungal spore or a cell lands on something like blood agar and it's warm, it's going to grow as a yeast cell, as shown here. Okay. In contrast, if it lands on Sabouraud's agar, say at 25 degrees or even 37 degrees, which isn't as rich a substrate as, say, blood agar is at 37, instead of growing as a yeast cell, it's going to say, you know, things aren't that great. I'm going to try and grow and get out of here. So I'm going to grow as a mold. And as I showed you, a mold, a single cell can fill an entire plate. So this is a mold growing on a hunt for better environments, more food, easier to get at food. And if it doesn't find that, it's going to essentially form an asexual spore or conidia that if it lands back on blood agar or a patient at 37 degrees, it's going to grow as a yeast cell. In contrast, if it lands on another agar plate, it's going to grow as a hyphae. So this is dimorphism, and many fungi that we're going to hear about today are dimorphic. Okay, that said, okay, so yeast, mold. Okay, how do we observe fungal infections? Okay, most fungal diagnosis, whereas we can use PCR, is still made on the rapid diagnosis of looking at a fungally infected tissue and observing the fungi. This may be by essentially, if we're talking about skin infections, treating the skin where we think there's infection with a little alkali solution, 10% KOH, which will essentially cause all the animal tissue to dissolve, leaving behind that fungal cell wall shown here, which is totally unreactive to sodium hydroxide, and it stays in there. And as a result, we can see the remnants of these hyphal tubes from infected cells. We can also stain this a little using a fluorescent dye called calcifluor, shown here. The other way we'll hear about some CNS infections, central nervous system, meningitis infections, where the fungi infect the cerebral spinal fluid, lowers the amount of glucose in them, by the way. And when we look at them directly in the microscope, usually we spin the CSF down and we can see yeast cells in them. Sometimes they're encapsulated, other times they're not, depending on what fungus we're looking at. We can also stain pus or other infected tissue using a protein stain called gamma methanamine silver stain. Silver stains proteins. If you've ever run a gel, you've stained it with silver often, and you can see the yeast cells in the pus, and they stain black. Finally, we can use crystal violet and repeat a gram stain on it, and you see that they stain nice and purple because they have that polysaccharide membrane. Now, we don't refer to these as gram positive or gram negative because it's of little to no, it's of no diagnostic ability, but we can use gram stain to stain fungi purple. It's all you need to know. Okay, another way of observing fungal infections is a number of fungi, particularly Microsporum, that fluoresces ultraviolet light. So a dermatologist might contain in his office a long wavelength ultraviolet light called a Woods lamp, and he'll shine a light on a kid who he suspects has ringworm of the scalp, and his scalp will show fluorescent spots where the infection is on the scalp. Okay, so that's the way we diagnose fungi, mostly via direct observation, okay? Other times we still do PCR, but again, for a lot of the fungal infections, it's just easier to see an infected area and take a quick microscopic slide of it. They're easy to see. Okay, how do we treat a fungal infection? Okay, remember I told you that fungi, instead of having cholesterol, contain ergosterol in their membranes. And as a result, we have a bunch of different antibiotics shown here that treat these differences. And what that difference in the cell membranes are shown here with these. And then these two antifungals we'll get to in a minute. So probably the most effective antifungal and probably also the most dangerous antifungal is called a polyene antibiotic, or sorry, polyene antifungal. And you can see the polyene structure over here. It's a complex structure, something you don't have to memorize, but this complex structure will incorporate into cell membranes that preferentially contain ergosterol. And as a result, they go better into fungal membranes than into human membranes. And when they incorporate into fungal cell membranes, they create aqueous pores, as shown here. You see these hydroxyl groups, and that essentially destroys a fungus's cell membrane and its ability for that membrane to work, because molecules can get in and out, and it can't maintain it can't maintain what it has to do internally to grow again, and this fungal cell dies. Okay, now it turns out that whereas it's preferentially incorporated into ergosterol containing membranes, it is incorporated somewhat into cholesterol containing membranes. And as a result, polyene antibiotics actually have a good deal of side effects like kidney failures, which require a nice cell membrane in order to transport things. So we try not to use amphotericin B, the most common of them, so much so that it's called amphoterrible. So we don't use it very often, but it is a very effective antifungal, but it's still a drug of last resort. The other antibiotic that goes towards antifungal that goes towards inhibiting ergosterol biosynthesis are the azoles. And here we have ketoconazole and fluconazole, and we see the azoles, the imidazole, 5-member nitrogen-containing rings shown here, that are also effective antifungals because they inhibit ergosterol biosynthesis. And if you can't make a good membrane, you're not, remember I told you in the first lecture how sterols make the membrane tougher. And if you can't make a good membrane, you're not going to live very long. Okay, finally, we have terbinafine, otherwise known as Lamisil, which inhibits squalene epoxidase or squalene monooxygenase. And terbinafine, this reaction is one of the first reactions and it's fungal specific in its effect. It's one of the first reactions in the biosynthesis of cholesterol. It takes squalene and it processes it. And if we inhibit it, the cell accumulates squalene, which is a toxic intermediate, and the cell dies by poisoning itself on its own squalene. Okay. Finally, I want to leave the membrane inhibitors and move on to echinocandins, otherwise known as caspofungin or cancetus. These again are complex organic molecules. They're actually produced by other fungi, and they inhibit glucan synthesis. So they're kind of like the penicillin against fungi because they inhibit cell wall synthesis, and no cell wall, no ability to grow in low osmotic pressure. Fungi die. Okay. Finally, the last one I want to talk about are nucleic acid analogs like fluorocytosine, shown here, which inhibits nucleic acid synthesis. These are often used in combination with other antifungals. And again, maybe have some side effects shown here. So here's a quick summary of what I wanted to tell you about antifungals. It's all you need to remember when you're studying. And let us move on to the area of infections. Okay, and we're going to start on the surface and then move inward as we go along on this lecture. Okay, so let's start off with our superficial mycotic infections, and we'll first start off with this and then go on to these other kinds of infections. Okay, and we referred to fungal infections wrongly as tinnias. Of course, it comes from the term worm, and you heard about a bunch of worms last week from Dr. Bellafato. And these are called ringworms because they form these round infectious circles like this, hence the name ringworms. And when you look at them in the microscope, you see these tubes, and people thought they might be worms, I guess, how they ended up being called ringworms. And we classify these ringworms depending on where in the body they affect. So if it's on the head, it's Tinea capitis, or ringworm of the scalp. If they're on the feet, the skin of the feet, it's Tinea pedis, or athlete's foot, or ringworm of the foot. Beard, Tinea barbi, jock itch, Tinea cruris, and finally Tinea unguium, which is onychiomycosis. This is misspelled, sorry. I have so many versions of the slide, and I thought I got them all, but clearly not. Take out this N over here. Okay, so it turns out that there are 3 genera of fungi, all capable of infecting the skin and producing similar disease states here. These disease states are by mostly what they cause is scaly skin and itching. Okay, and these genera are trichophyton, epidermophyton, and microsporum. This is what you should memorize. Whether you memorize the species name is up to you at this point. Just remember trichophyton, epidermophyton, and microsporum. Okay, and these are the common tinnias or dermatophytoses, and they don't look like this guy. Okay, that's not this guy. What they look like growing on a plate is here. Here we have trichophyton mentogrophytes, and Trichophyton rubrum, the red Trichophyton. Again, you don't have to remember the species name. These are slow growing. All of these three genera are extremely slow growing. It takes about a month to produce this growing on Sabarod's agar. If you give it a little olive oil, because they like lipids, okay, it'll grow a little bit faster. And most important, it won't grow above 34 degrees, which is why we find them only growing on skin. Okay, skin is a little cooler than the rest of our body, so they really don't want to go internally. They can barely grow at 34, 37. They're pretty much incapable of growth. Okay, so, and they're slow growing. What also these guys have in common is they produce macroconidia, or big spores that look very similar. These are all called alorospores, shown here. But these are the three genera that cause these syndromes. Now, it's interestingly, mostly when you're looking at a KOH-treated skin that's infected, you don't ever or rarely see these alorospores. You only see them when you're culturing them. So how do you get one of these skin infections? Well, you've all heard cases of don't walk around the locker room with your bare feet. And that's because when somebody has a skin infection, one of the things that this guy does, as the fungus does, is it secretes a number of proteins, and those proteins can be allergenic. And when something's allergenic, it makes you itch. And when you itch, you help that fungus, because what do you do when you itch? Okay, you scratch that area. And when you scratch that area, you cause this scaly skin that is being degraded by those fungal proteases and other enzymes, keratinases, which is a protease, to essentially flake off, end up on the locker room. Then this guy is walking around without his flip-flops, and a piece of skin gets into his, in between his toes, or on his toes, and in that little cuticle over here, and you get an infection, and that infection itches, and this guy scratches it, and it gets passed along more and more. It can go into the nail bed and cause a nail infection called tinea unguium or onychiomycosis. And if you scratch and scratch and scratch and scratch, you can get more allergic response to it. You can get bleeding, you can get pus formation, and it can become more severe, very often compounded by a bacterial skin infection due to that tissue damage you've done by all that scratching. Okay, here you can see a kid has scratched his head so much that it's now bleeding and oozing pus. Okay, if you have a nail infection, as we can see here, okay, that nail can actually cause a hyperkeratosis where the nail thickens. I call that altacaco, or old man nails. You often see old people with these really gross nails that are really thick and ugly looking. And that's because that fungus is growing within that nail bed and causing a hyperkeratosis effect, more nail material being produced. What you can also sometimes see is that as you go here, the nail is dissolved and has holes in it. And sometimes in fingernails, the nail won't even grow out to the end of the finger because it's basically degrading the nail as you go along. Now, that's actually important for therapy, because how do you treat a nail infection? Okay, you can't get antifungals in on the nail bed because it's underneath the skin, and the antifungals don't penetrate that very well. So you have to treat these systemically, usually with an antifungal, and treat for a long, long time till that nail bed grows all the way out to the end and there are no more fungi growing within that nail bed. So you have to treat for like 6 months. In contrast, for these guys, an ointment of some kind that contains an antifungal is most effective. Okay, we'll get to a little more about treatment in a bit. And I want to tell you about two other things, or three other things, also referred to as tinnias, but are caused by different kinds of fungi. The first is tinea favosa or favus, caused by Trichophyton schoenleinii, a completely different species of Trichophyton shown here. Okay, and that causes hair loss sometimes and hyperkeratosis, almost always in the scalp. Not all the time, but usually it's found within the scalp. Okay, another form of tinea is tinea versicolor, which can be light spots or dark spots. And in these spots, by the way, in these spots or in these spots here is where we will find fungi if we are doing, or here, where we will find fungi if we're looking at that under the microscope to try and diagnose these things. Okay, so tinea versicolor, okay, a lot of people have this. They say, what are these brown spots growing on my chest or on my back, or these light spots? Hence the name versicolor, is make light spots or dark spots. Those darks, sometimes it inhibits melanin production, producing light spots. Sometimes the fungus itself is so dark that it produces dark spots, okay? Can't really tell. It's all called tinea versicolor, and it's caused by Malassezia globosa and Malassezia furfur, okay? Interestingly, this fungus has recently been associated with gut and pancreatic cancer. This fungus has been found in the infected organs. And at this point, people, it's just a curiosity. We'll see if it actually has any role in that. But nevertheless, mostly it's a pretty benign infection. It usually doesn't even itch. It rarely even itches. Okay, but it is discoloring, and people will go to the dermatologist and say what's going on. It'll give you some anti-fungus to spray on it, and hopefully it'll go away. Tinea nigra is black palms, also a fungus called Exophiala that is very dark pigmented, that will grow in your skin, shown here. Okay. Finally, there's a disease called pedra of the hair, caused by this. This grows out to be a black fungus, hence this is called black pedra, grows on the hair shaft. And then we have white pedra, also caused by a fungus that grows on the hair shaft. And because this grows as a white colony, it's known as white pedra. And this is the first time we're seeing arthrospores, by the way, these jointed little asexual spores growing within the hyphae. Okay, so all of these can be seen by looking at hair or skin and treating with KOH. And mostly what you see are the remnants of these hyphae, shown here. Doesn't look like this guy. Or again, microsporum, you shine an ultraviolet light on it, not a short wavelength, those are mutagenic, okay, long wavelength ultraviolet light, okay, the black light that you find in a amusement park is what you use, okay, called the Woods lamp. All right, if you were to do a cross section of infected skin, you might find some fungal tubes growing in the outer layer of the skin. You might find slightly a little below that some yeast cells in the case of a tinea versicolor, shown here. The other thing that fungi do is, remember I said that they cause an allergic reaction. People don't like those foreign proteins being secreted on their skin, and many people develop what's called the dermatophytid response, or simply id response, where they're getting an allergic reaction over their body, where they get these little pustule-like hive-like structures on their body that can be itching. Now, the important thing is that there are no fungi in this part. If you were to do a skin scraping, you wouldn't find a fungus. But if you were to essentially see this, you might look elsewhere on the body for a superficial dermatophyte infection, and then do a skin scraping from that, where you might see the evidence that the person has a skin infection. Okay, the drugs that we use, we talked about, shown here. Mostly we try and use imidazoles like Lotrimin or terbinafine, Lamisil. We don't necessarily use amphotericin. That's too toxic. Okay, we used to use something called griseofulvin. And then there are a bunch of older remedies, like you probably may have heard of Desenex or Whitfield's ointment or Tinactin. These are simply detergents. And these detergents, fungi like other microbes don't really like soapy detergent amphipathic compounds. So they're not as effective as these antifungals. Okay, let's talk for 5 more minutes. Let me talk for 5 more minutes and tell you about a little bit deeper infection called subcutaneous mycotic infections, where you have to be stabbed with the fungus underneath your epidermis, underneath the outer stratum corneum, and it's going to grow and cause a little bit more severe, painful infection. And the first one, most common one, is Sporotrichum schenkii, which causes a disease called sporotrichosis. Here we have the first dimorphic organism we're going to be introduced, where it's growing on Sabouraud's agar as a mold, but growing on blood agar as yeast cells. And you can see the yeast cells growing on blood agar, or the mold with hyphae and blastospores coming off of it on growing on Sabouraud's agar. Okay, at the different temperatures. And Sporotrichum schenkii causes sporotrichosis, shown here. And sporotrichosis comes in 2 flavors. In one, you get poked by some of this and it invades your lymph nodes, and it essentially travels up and down your lymph nodes, growing these cells that ultimately emerge and rupture out of those lymphatics to give you a skin infection that traces your lymph duct, shown here. Okay, that's called lymphocutaneous. Or if you get stabbed, it can just spread underneath your skin and just in a rather unstructured way, just basically cause these lesions over the area close to where the initial poke occurred, probably over here, and will spread out underneath your skin. It's rather painful, cause a lot of necrotic necrosis and allergic response, and needs to be treated. Okay, if one looks at it in the microscope and looks at these pussy lesions, one sees the organism, which is a rather elongated yeast, and this is stained with silver. We've seen this slide before. How do you get sporotrichosis? Here's my favorite story. A 65-year-old man developed a large sore in his genital area that refused to heal despite dozens of tests and 7 medications. It turned out he had sporotrichosis, a fungal infection from plants that he probably picked up when he urinated against a rose bush at his favorite golf course. Okay, now that goes to the fact that sporotrichosis is sometimes called rose thorn disease, and agricultural workers working on rose bushes sometimes get it because it's a normal soil fungus that's out there. It gets on a rose bush and a rose thorn and can cause that infection. Other soil organisms that cause subcutaneous infections are these guys: Pseudoalascheria, Margarella, Exophiella, and Aspergillus. We'll hear more about that later. Get poked in you, and you can get a pretty horrible lesion-like infection growing out. This is clearly a lesion that was completely neglected and allowed to get worse and worse and worse and worse all over his foot. Probably has a compound infection with a bunch of bacteria, in addition, causing this erythromatous inflammatory response. Okay, this infection is difficult to treat. because it's hard to get the antibiotics to every portion of it. It often grows all the way in. Here you see this fungus growing in all the way towards the bone. Over here, it grows very deep, capable, because it is capable of growing at a low oxygen pressure, because it can essentially grow with a little bit of glycolysis, doesn't need a highly aerobic environment. And again, these things can be due to superinfection and can be also be caused by other bacteria, in addition to mold, like actinomycetes can actually cause this infection. So one of the things we have to do if we see a case of mycetoma is make sure that there is fungus there in addition. If there's bacteria there as well, we have to treat both bacteria and the fungi. Okay. Another sub-Q infection is known as chromomycosis. As the name implies, chromo-colored. It produces this dark colored infection. It's caused by Fonseca, Cladosporium, Phylaphora. These all can produce these cauliflower-like lesions that are very difficult to get rid of because you can't get the antifungal anywhere near. Now, this is also a case of incredible neglect. The reality of what you would see in one of these infections in anybody's normal practice would be a little lesion like this, almost look like a wart, and would be mistaken for a wart. But when the wart medicine didn't work, you might want to take a quick look under the microscope to see if you can find these sclerotic bodies, which are simply spores, perhaps sexual spores of them that are produced by these organisms shown here. If we culture it, we see a mold with very thin hyphae shown here, and these spores shown here. Okay, so for what we're going to take a break. The most important organisms that I want to tell you about that you should make sure you know are shown here. They're listed here for the various ringworms, for Favis, Pertinia versicolor, for sporotrichosis, as well as these subcutaneous other infections shown here. Okay, so just make sure you remember those names. With that, it is now 2:58. We will begin again at 3:03. Okay, so take a break, and I'm just going to shut my camera and mic for a few minutes and take a drink of water and walk around and stretch. You should do. Want to make sure we're recording. I can't tell that I'm recording.
Yes, we're recording, David. We're
Okie
good.
doke. All right, everybody's back here now. You know what? Turn on your pictures. Let me see what you all look like. I got my other screen going on here. All right, don't bother. Maybe you'll do it at the, hi, everybody. Okay, good. At least I know one of you's there. All right, now I'm standing up. I got my standing desk, very fancy desk. I'm going to try and lecture standing up for the last hour as we move on deeper, okay, in the world. And what I want you to do is listen to this at your own time. And as you've heard me say, country music is the root of all wisdom in life. And here is a song by Johnny Cash. Maybe we'll play it in a little while about systemic fungal diseases. Okay, that said, okay, this is just a quiz question for you to go through about the easiest way to differentiate a fungal cell from a bacteria in the microscope would be, okay, all of the above with one exception. And that exception would be fungi are not the only thing that have a cell wall. Okay. All right. Oops, we're going in the wrong direction. Okay. All right. So, but probably the easiest thing is finding that fungi are much bigger than bacteria. And we know that fungi are not affected by by penicillin, if you read this, okay, and if you look at this question, and none of the answers are right, except this last thing, their cell walls are not cross-linked by D-alanine containing peptides. Okay, so these are 2 sample questions for you. Okay, this is my favorite, weirdest systemic infection. This was a guy who actually had a yeast infection in his stomach and was making beer in his stomach, and he was belching up stuff that smelled like beer. One of the weirdest cases I've ever heard about. You can read about it on your own. Okay, it was an NPR story. What we're going to talk about now are systemic mycotic infections. At first, we're going to talk about these, which all present pretty similarly. Okay, histoplasmosis, North and South American blastomycoses, coccidioidomycoses, and cryptomycosis. Okay, and all of these, including Cryptococcus, have dimorphic life cycles, okay, as well as something about the geography of where you find these organisms. The only exception to that geography is Cryptococcosis, because the organism is found pretty much everywhere. But all of these, as you're going to see, have rather restricted geographies. And part of being able to tell one fungal infection from the other has to do with where they were and where they may have gotten infected. Okay, with that in mind, these infections are all transmitted by inhaling either a small mold spores, or in the case of Cryptococcosis, usually a yeast cell, but sometimes a spore. They usually produce a mild or asymptomatic respiratory tract infection in a immunocompetent person. These infections usually self-resolve, and often, if you get one that's deep-seated in the lungs, it may resolve, leaving a small calcified granulomas. This is actually important in the sense that these used to be confused for tuberculosis. However, if you're immunocompromised in some way, okay, whether you're on steroids or corticosteroids that suppress your immune response, or you have some immune suppressive disease, etc., in which case you can get a severe systemic infection causing skin lesions that arise, meningitis, organ involvement, and very often death. They can be very fatal in immunocompromised patients. And they're all diagnosed usually by finding the organism, but we do have some immunoassays, PCR, and even mass spec after they're cultured. Okay, they're all treated usually with imidazoles and amphotericin B. They're trying to get echinocandins that work a little bit better as well. Okay, so let's look at histoplasmosis. Okay, here's a case of a primary lung infection. You can see that pneumonia that I spoke to you about with this lung consolidation, and ultimately it will heal, leaving these granulomas shown here, these spots on the lung, which are not due to a tumor. Okay, just so you know. If you were to slice one of these granulomas in a lung biopsy, you would see sometimes even live fungal cells growing within this granuloma. Okay, here's a microscopic observation of it. One of the most important things I'm going to tell you about histoplasmosis is its geography. This is where you mostly find histoplasmosis, concentrated around Midwestern river valleys, shown here. Midwestern river valleys, not too much in our area. Okay, this is what the organism Histoplasma capsulatum that causes histoplasmosis looks like. It is a dimorphic, classically dimorphic mold yeast. On 37 degrees, it lives as a yeast, which is what we find in infected tissues. Okay, you grow that yeast on Sabouraud's agar, you find a mold that exhibits tuberculate chlamydospores, shown here. These are bumpy spores, bumpy, large, round spores, tuberculous chlamydospores. If we were to look at this stuff in the microscope, we would see little tiny yeast, not all that much bigger, only about twice the size of a bacillus that we learned about. Little tiny yeast. Okay, this organism loves to grow on bird droppings. Okay, so one of the things we find in it is in taking history of a patient is, oh, I cleaned out my old attic. It was invaded by bats and birds, and there was dried up guano all over the place. That is a common source of these spores. Okay, now histoplasma is really good at growing intracellularly. It is a facultative intracellular organism, grows within vesicles shown here, but can also grow within cells. Okay, and one of the things it does, it produces a lot of ammonia, which raises the pH in these vesicles, and that prevents the lysozyme from acidifying and killing these guys. So it's got an effective way of dealing with that. So we find it intracellularly growing within macrophages and other kinds of cells. Okay, histoplasma capsulatum. Now, my favorite celebrity case of histoplasma is a 56-year-old singer from Minnesota. When asked, how do you feel? He responded like a near-dead Rolling Stone. Actually, what he really said is they thought I'd be seeing Elvis soon. And basically, sputum and bronchial alveolar lavage of his lungs revealed that he had histoplasmosis. They found a little small budded yeast in these lavage samples, and they cultured them and found tuberculous chlamydospores. And the singer was hospitalized, given amphotericin B, and went home to recuperate, and he survived. Okay, and I'm not going to sing you this song, but it provides homage to the guy. And we had our remote working, you can decide who this likely patient was on your own time. But at the same time, Johnny Cash wrote a song about histoplasmosis and caught a cold with the window open, crow droppings on my windowsill. Tells you how you get it. Probably got histoplasmosis. If I had a gun, I'd kill those crows. Beans for breakfast once again. Here's a YouTube link to the song. As I mentioned, all knowledge can be found in country music. This is not as well. All right, with that in mind, let me quickly go through the other systemic infections and what's same and different about them. North American blastomycosis. As I mentioned, you get a systemic infection. You can have these skin lesions that arise due to them rupturing through the skin. Okay, there's another one actually up here. And this is caused by blastomyces dermatitidis. This organism has a slightly different geographical area compared to histoplasma capsulatum, largely overlapping, but it goes a little bit further north to the Great Lakes and the St. Lawrence River as well. It looks completely different. It's a much, much bigger yeast cell shown here. It's got a big base at the site of the bud shown here. The colonies are a little bit drier. But again, when you look at the mold phase, this is what you would find in infected tissue. I'll show you a picture in a minute. When you look at the mold phase, all you see are hyphae with a little bit of spores. Okay, blastomyces dermatitidis. Again, the syndrome is very similar to histoplasmosis. Okay, and here's that big yeast growing in a clinical sample from a lung. Okay, South American blastomycoses, very similar again, skin lesions associated with systemic infections. Obviously, if it gets into an organ, it can be quite lethal, causing organ failure. All of that's true for all of these. Okay, what's distinguishing about South American blastomycosis, aside from the fact that we usually only find it south of our border, maybe a little bit in South Texas, but everything else is restricted to everything south of that. Okay, and that tells you a little bit about the name Paracoccidioides brasiliensis, clearly South American blastomycosis. Okay, and what's distinguishing about this organism is the multi-budded yeast cells that you observe in clinical specimens when you sample a lavage from a lung infection. Multiple budded yeast cells. Here are both, a single cell will give rise to multiple buds. The name of the organism, again, Paracoccidioides brasiliensis. Here's another picture of it, shown here. Here you can see the septate hyphae that it gives rise to, with some blastospores coming off. These cells will give rise to these guys if grown at 37 degrees on blood agar. This is what it looks like on sabrodes. Okay, classical temperature dimorphism. Okay, now we'll move on to coccidioidomycosis. This is a little bit different. Okay, first of all, it is a desert fungus, grows mostly in the desert areas, very dry areas of the American desert, goes further south as well. This organism generally grows, will give rise to hyphae and spores during the rainy season that will grow in the wetted soil of the fungus. And then when the soil dries out, the fungus will produce a lot of arthrospores that can get whipped up in the air and infect people. Almost everybody in this area of the country has gotten an asymptomatic infection of that organism and is making antibodies to it. But nevertheless, immunocompromised people, and that asymptomatic can have had very mild symptoms, but immunocompromised people are at risk for developing a dangerous respiratory and systemic infection like the other organisms. And a number of infections were seen at one point when a bunch of model airplane enthusiasts were flying their model planes in the desert in the middle of California around here, and they were kicking up a lot of dust, and a lot of these guys who were from England ended up getting sick from coccidioidomycosis. Now, coccidioides is that causes this organism, Coccidioides immitis, causes coccidioidomycosis, is different. It doesn't have a yeast cell phase. It has a mold phase shown here, okay, that produces arthrospores. But instead of a yeast phase, it grows at what are called spherules. This is a syncytial type of growth that we see, that I'm going to explain in a minute, multicellular syncytial growth. And in addition, you might see hyphae growing within the lung, because the lung isn't that warm because it's constantly being cooled down by the air we breathe. Anyway, what a spherule is one of those arthrospores will germinate within the lung. And now what you'll get are mitotic nuclear divisions shown here as the spherule grows and grows larger. And when you get about 100 nuclei in that spherule, you'll turn on cell membrane and cell wall growth, and you'll encase all of these nuclei into spores that will then rupture from the spherule, and each one of them will produce a new spherule shown here. So the spherule is the infective stage instead of the yeast phase that we see on blood agar at 37 degrees. But when this thing is growing in the soil, in the sand, it will grow as a arthrospore containing hyphae shown here. Okay, let's finally move on to the fifth organism, Cryptococcus neoformans or Cryptococcus gattii, which both causes cryptococcosis. Cryptococcosis, these yeast cells, very closely related to each other, are both encapsulated yeast cells, shown here. They make a nice thick polysaccharide capsule like we learned about for bacteria, helps them evade the immune response. Okay, that capsule can be thick or much thinner. And when we see these in cerebrospinal fluid after a systemic infection that has infected the spinal cord, what we'll see is this halo around them. Now, histoplasmosis will also cause meningitis, but we won't see this capsule around histoplasmosis. But when we see this capsule in the CSF of a slow meningitis, unlike a bacterial meningitis, this kind of meningitis will come on as a mild headache that will come on very slowly, maybe with a low-grade fever over weeks and over several weeks, whereas a bacterial meningitis, as soon as it comes on, you got to treat it aggressively and very quickly, because essentially it will kill you in a day or two. But this is slow meningitis, okay? Now, it doesn't exhibit that classic temperature dimorphism, but you can coax it into a filamentous sexual phase if you know exactly what to do. And this organism also grows in bird droppings. I want to point that out. And we see that when we hear a history of somebody cleaning out their old garage, making up lots of dust. Here's that organism again in cerebrospinal fluid. Interestingly enough, we grow it on a kind of agar called birdseed agar, where one of the things it does on this agar is produce lots of dark pigmented melanin, shown here. And that's one of the ways we know we have Cryptococcus neoformans or Cryptococcus gattii, by the production of melanin. Okay, it can produce skin lesions, shown here. And again, if systemic infections are only found in immunocompromised patients. Okay, and occasionally it can go into the brain, shown here, and you can see the yeast cells, these black guys here. Okay, and here's an interesting case of an MRI of a man complaining of a worsening headache and ataxia, and they saw a lesion in the brain. They said, gee, is that cancer or is that something else? And they resected it, and they found, looking in the microscope, that the guy had Cryptococcus. It was a yeast cell. It was filled up with yeast cells. They resected it, treated him with antifungals, not anti-cancer drugs, and the guy made a full recovery. Okay, my favorite story is Cryptococcus made it on House, which you may not remember because it's about 10 years ago, where House says, bucket full of pigeon crap, perfect home for Cryptococcus neoformans. And Cameron answers, yep, fungus enters the brain through the sphenoidal sinus, where it dances its triple thread of happiness, blindness, and intractable pain. See you back home soon. He was so poetic. We miss House, at least I do. Okay, that said, that's all I want to tell you about these organisms. Now, these organisms can cause a little bit of sickness, a little bit of infection. If you're not immunocompromised, a little bit of a lung infection, okay, maybe a skin infection if you get poked by it, but generally is self-resolving if you're fine. The rest of the organisms are truly immunocompromised, opportunistic infections where you only get any kind of symptoms if you are immunocompromised. And that's because they are all around us, okay? Candidiasis, aspergillosis, zygomyces, pneumocystal pneumonia. These are all organisms that are either commensals, part of normal flora, shown here, or are just so omnipresent in our environment that we can't avoid them. So as a result, they're not really pathogens unless you are immunocompromised. Here's a case. We have a 38-year-old female professor presents with erythema around her vaginal area and a white pasty substance coating the vaginal mucosa. She started feeling discomfort in her infected area about a month ago and admitted she was taking corticosteroids for 3 months to relieve pain and athletic injury. The attending physician advised her to try Advil for the foot pain. He gave her free samples of 1% topical clotrimazole, aka gynolotrimine, to be applied to the infected area for 10 days, and the infection resolved, and her ankle pain eventually went away. Okay, candidiasis, is a very common cause of vaginitis, infection of the vagina, as we just saw. And if we were to take a sample of the vaginal mucosa and looked at it under the microscope, we would see these yeast cells indicative of Candida albicans. If we were to grow this, we would see these white yeast. If in fact that person had a different kind of Candida called Candida glabrata, you wouldn't see these white yeast. Candida albicans is the more pathogenic of the two, though they're both considered normal flora, and everybody gets Candida albicans in their birth canal, okay? Moms, everybody, all, it's normal flora of the vagina and also of the mouth, but it's kept in check by other part of our normal flora that prevent it from really causing an infection. You can remember Candida albicans by the fact that it's white, as Jessica Alba is, but rather than remember this person, Jessica Alba, I'd rather you remember Paul Dudley White. And Paul Dudley White is the founder of modern preventative cardiology. He was Dwight David Eisenhower, the president's physician, when he had a heart attack. And he's the guy who said, after you get a heart attack, the best thing to do is resume and learn how to get exercise and get your heart strong again. So he's the White we should remember. Jessica Alba, she's pretty good in Fantastic Four, I guess, but this guy certainly had greater talents, in my opinion. That said, Candida albicans shown here can also more commonly cause oral thrush in babies, and babies are immunocompromised because their immune system haven't developed. So it's very common for babies to develop this pasty-like substance due to an infection of Candida albicans that they got in the birth canal of their mom. And if their mom didn't give it to them in their birth canal, the first time Aunt Foofy picks up the little baby, she's giving that kid Candida, okay? Because it is common normal skin flora of pretty much everybody, okay? If we look at oral thrush under the microscope, we would see epithelial cells with hyphae, as well as pseudohyphae, as well as yeast cells growing all in that mucosa, okay? Candida is really dangerous, okay? It can cause a systemic infection that can affect the retina, the skin, as well as systemic organisms. You get it in the hospital, you have an infection, it is highly fatal. They try treating it with amphotericin sometimes, but it's highly fatal if you're immunocompromised and you get a systemic infection. Okay, here's a systemic infection where you see mouth infection as well as nail infection involvement. Again, Candida albicans. And one of the quick ways we can tell Candida albicans from other kinds of fungi is what's called the germ tube test. What we do is Candida albicans is completely opposite from all the other fungi that I told you about. When you give it a little bit of blood serum, instead of becoming a yeast cell, okay, it will essentially differentiate the opposite way, and in the presence of blood or blood serum will actually grow into hyphae. So that's one of the ways we quickly speciate Candida albicans and tell it apart from all other fungi, dimorphic fungi, is that it grows a germ tube in blood serum as opposed to other fungi, which will stay as a yeast cell. Okay, it can also form chlamydospores on cornmeal agar, nothing you really have to know about. Recently, another species that's highly drug resistant evolved when they found it in somebody's ear, hence the name Candida auris, okay? Basically it's very resistant to most antifungals, and it can also cause thrush as well as systemic infections. And this is very dangerous because we're still not good at treating it due to its high level of resistance to other antifungals. Okay, the last two obligate immunocompromised organisms I want to mention are pneumocystis jirovecii, which causes pneumocystal pneumonia. Okay, we once thought it was a protozoa because it formed these things that people thought were protozoan cysts. In fact, they were yeast cells, and it's indeed a yeast that was determined when we analyzed its ribosomal RNA, because it didn't look like a protozoa. The ribosomal RNA sequence was clearly a fungus. Okay, it can cause lung infections in immunocompromised people. We treat them with trimethoprim, sulfamethoxazole, common antibacterial treatment, but one that goes towards one carbon metabolism. Okay, and again, this is considered normal flora, and everybody has been exposed to it in the droplets of other people. But again, if you're immunocompromised, you're at risk for pneumonia. Otherwise, it's nothing to worry about. Aspergillus is a bread mold, a food mold, very common out there. You put out a piece of bread and you'll see a green mold, that's penicillin. You see a yellow mold, that's aspergillus. It may be a little black. We see these conidia on it. You get an aspergillus infection if you are incredibly immunocompromised. It can also form granulomas in the lungs that ultimately actually still have live cells in that. It can grow in blood vessels, as shown here. And the thing about aspergillus and aspergillosis is if you're immunocompromised, it is extremely rapid growing for a fungus, almost grows as fast as many or even faster than many bacteria. And if somebody gets a systemic infection by it and it's untreated, it is going to kill them. One of the hardest things is diagnosing it very quickly. And again, uncontrolled diabetics with lots of sugar in their bloodstream, this guy will grow even more rapidly. But again, only immunocompromised patients. And finally, similarly, another thing is zygomycetes. Here we're looking at an organism called mucor. It is an non-septate fungus shown here. Okay, again, like sugar, likes diabetic patients, grows rapidly. You can almost see the hairs of the hyphae here. Okay, so that's all I want to say about this, another organism that causes infections only in immunocompromised people. Okay, now I want to tell you about other things that fungi have caused disease. Maybe you remember, but almost 10 years ago, there was a disaster in the sense that a compounding pharmacy, that's a pharmacy that produces custom-made medicines for injection, and they were producing a corticosteroid, methylprednisone, for injection for people who had joint infections orthopedic surgeons were injecting into them, and 14,000 people received contaminated steroid preparations from these, and that's because these guys can grow almost anywhere. They have simple growth requirements. In this case, there was enough acetate, I think, in the preparations from some other compound that they were using in the preps that was enabling the fungus to grow. They sent around 14,000 dosage of these things, or probably more, and 750 people came out with meningitis, and there were 50 people who died because of this. They were injecting a normal soil or environmental fungus under their skin systemically, and it was a disaster that put the New England Compounding Center out of business, to say the least. You don't have to memorize the name of this organism. But again, fungi in the wrong place at the wrong time can be quite lethal. even if they're not considered pathogens. The other thing that can happen is fungi can grow in wet areas of our buildings and we have molds growing in our buildings. This is something known as sick building syndrome, where people essentially enter a building and get sick. It's usually some kind of allergic reaction, maybe due to toxins, and I'll tell you about fungal toxins in a minute. Stachybotrys is one kind of fungus that we know produces these things. Aspergillosis is another one. The symptoms are rather nonspecific. People are sent home. People don't recognize. There are lawsuits involved in it. And the bottom line is that fungi, and sometimes it's just a strain of fungus, can produce a toxin that some, but not all people are sensitive to. But we do know about some fungal toxins, and shown here, are three organisms that produce very well-known toxins. Amanita phalloides, for example, the standard mushroom, I think death stool, I think it's called over here. There are forms of Amanitas that are quite beautiful that produce these things. And these produce a compound called alpha-amanitin that you may have heard of because it inhibits RNA polymerase, but more importantly, it is a nerve toxin. It's a neural toxin, binds to lots of different proteins. Okay. In addition, they produce phalloidin, which is a muscle toxin. And one of the ways, if somebody gets mushroom poisoning and they come in there, they suspect mushroom poisoning, what they'll give them is raw meat to eat, with the idea that the actin in the meat will actually soak up the phalloidin and essentially help out the symptoms of that. Another fungal toxin is psilocybin, produced by this organism, psilocybin cyanescens. Okay, this is a hallucinogen. Okay, when we talk about mushrooms and hallucinogenics, and if you've ever read Lewis Carroll, you know that Lewis Carroll did psilocybin mushrooms quite regularly. Maybe that's why he wrote Alice in Wonderland or Through the Looking Glass. People have speculated about that. And finally, aspergillus, this common food mold, is known to produce aflatoxin, a highly carcinogenic compound when it finds its way into the body and through the liver, where it's turned into a carcinogen. Ochratoxin is a hepatotoxin. And there are numerous cases where we find people eating rotten foods who end up essentially with a tumor due to the fact that this carcinogen has caused it. Whole populations that were eating moldy peanuts, for example, this has come by. All right, so here is a picture of aspergillus again. Another picture of aspergillus. And I think that is pretty much everything I want to tell you about fungi. So I'll be happy to entertain some questions, but I want you to all do what I do, which is I love fungi. Okay, but don't go out there and eat wild mushrooms unless you really know what you're doing, because fungi can be distasteful, especially this fungus here. All right, and that's pretty much all I want to say. So if there are questions, we have a couple of minutes before Dr. Whitehead starts. You can unmute yourself and ask away. And I'm going to take a seat. Gotta love this desk. I don't see any questions from the peanut gallery.
Looks like we're good, David. So I'm going to stop the recording and
All right. Good luck, everybody.
you can unshare your screen.
Thank you for listening.